I'm Matt Johnson. I live in Dallas, Texas. I'm the CEO at Early Sense, and I've spent my entire career at the intersection of health and technology. We spend a lot of time thinking about how to make technology that improves people's lives and helps them live in their homes longer. But we also spend a lot of time thinking about how to use the outputs of that technology to make clinicians more efficient. Ultimately, we believe that remote patient management and telehealth programs become the most valuable when they're operated at scale, in fact, at quite large scale. And so the underlying assumption there is that we can make technology that's, on the one hand, really technologically sophisticated, hospital-grade sensing technology, but that is also kind of readily fades into the background. People at home don't want to feel like patients. And so we know that if we can create solutions that fade into the background, that allow people to live seamlessly at home and interact with that technology in a way that requires almost nothing of them, that their compliance with that technology protocol goes way up, which means that clinicians get the data that they need at the exact time that they need it, and that ultimately the return on clinical care is exceptionally high. At Early Sense, we've seen firsthand the importance of compliance and really the impact that contact-free technology can have on improving compliance, especially for complex patient populations. So for example, we have a payvider partner who's using our technology to monitor mentally and physically challenged state Medicaid patients at home. And these audiences naturally have an aversion to touch, to contact, and to technology or routines generally. And our technology happens to be a perfect fit because it's contact-free. It only requires an individual laying in their bed. And so as we look to advance telehealth, we think it's important to consider how technology feels to the patient population that we want to serve and how it can support their overall health without impacting their day-to-day lives. So I have to think about telehealth and remote patient monitoring and management as this long tail that can be additive and in many times separate from a primary home health episode, and that requires a lot of creativity. And so that requires relationships with the payer community, relationships with other risk-bearing entities, to be leaders in engaging in people in their homes. And the fact of the matter is, the payer community, the risk-bearing community, is super interested in figuring out this last mile and figuring out how to engage and manage high-risk, high-need patients in their homes. And so who better than home health agencies to solve that problem? If they only view remote care and telehealth through the lens of the episode, it won't work. It's too limited. It's too brief. And so for these longitudinal episodes or these longitudinal care needs, we've got to think outside the box. And I think that's the principal challenge and the critical success factor here. My name is Matt Johnson, and telehealth is health.